Hi, I'm Dr. Bill Lewis with Tulsa Integrated Health, and this is our third video in our headache video series. In videos 1 and 2, I talked about stress, tension, and sinus headaches, and some natural tips and tricks that you can use to get relief from those types of headaches. If you missed those, you can find them on our Facebook page. Now, this video, we're going to talk about chemical type headaches. Headaches that are triggered by foods and certain food ingredients and other chemicals. So the difference between a chemical headache and more of like a tension or stress type headache is that typically, if you were to take an over-the-counter painkiller or anti-inflammatory, a tension or stress type headache, you'd notice some relief within about 15 minutes or so. That doesn't happen with a chemical headache. Chemical headaches come on about 1 to 2 hours after you've eaten a meal or a food with substance with these chemicals in it, and typically over-the-counter painkillers and anti-inflammatories won't help. You just have to wait it out. Your body has to have time to metabolize the offending substance. Now you can speed it up a little bit by drinking, plenty of water and flushing it out, but you're dependent on your body to metabolize it, and so typically those headaches won't respond to over-the-counter medications. So first on our list is different kinds of cheeses. As protein-rich foods like dairy age, they give off a chemical called tyramine. Now, certain cheeses have aged longer before they get to the consumer, before you eat them. So some people might be fine eating cheddar cheese, but then they eat Swiss cheese or blue cheese and they get a headache. And it's because maybe that cheese has aged longer, so it has higher levels of tyramine in it, and it triggers a headache. Second on our list is food additives like preservatives and flavor enhancers. So things like nitrites and nitrates that are found in wines. There's a reason why a lot of people get headaches after they drink wine is because of the nitrites and nitrates found in that. Those are also found in packaged lunch meats in the refrigerated section, not so much the deli section where you're getting freshly sliced meats, but in the refrigerated packaged section. So pepperoni, ham, salami, things like that. Then there's MSG. MSG is a big one. It's found in soy sauce. It's also found in Chinese food sauces, and also in packaged foods like potato chips as a flavor enhancer, particularly the more flavorful chips like sour cream and onion, that type of thing. So be on the lookout for MSG, nitrites, and nitrates. Then we have food colors, dyes like red 40. So red 40 is found in things that are red or combination of involving red, so purples and oranges, things like that. So M&Ms, Skittles, and beverages that are colored like that. Then we have medications. So medications will actually cause their own type of headache called a rebound headache, particularly Tylenol, Excedrin that has Tylenol in it, aspirin. If you're having a headache 3 or 4 times a week or even daily and you're consuming those over-the-counter medications, chances are some of the headaches that you're then getting are actually triggered by the medication that you're taking to try to bring some relief to your headaches. Next, we have caffeine. So caffeine is found in, of course, beverages like coffee and soda, soft drinks, but it's also found in chocolate. And so chocolate can actually be a trigger for people. Now, there's people that they want to withdraw from caffeine. And so when trying to withdraw, they then come across withdrawal symptoms like a headache, and the headache can be quite severe, and so then they just turn back to having caffeine to get rid of the headache. And so they're in this endless struggle with trying to withdraw from caffeine, so they just keep drinking it. Now, if you're one of those people, I have a natural hack that you can use to, within just a few days, withdraw from caffeine without those harsh withdrawal symptoms. And so you can look for that on our Facebook page as well. Now with caffeine headaches, typically you want to stay to 200 milligrams or less of caffeine per day. It's pretty easy to actually go over that if you're having a chocolate bar plus a cup of coffee or two, plus then, a soda later on in the day. You can get over that 200, and then by drinking more caffeine day in and day out, you start getting these caffeine type headaches. Now, number 6, our final food or chemical, it's not so much a food or chemical, it's actually a compounding factor, and that's dehydration. Most people these days are dehydrated. So number 1, dehydration can cause its own headache, and number 2, when a person is dehydrated, it makes them more sensitive to the other things that I just mentioned. So if a person is fully hydrated, they may not be sensitive to nitrites and nitrates and MSG and medication, things like that. But when a person gets dehydrated, then that's when those things can actually show up and trigger headaches as well. In order to rehydrate yourself, you want to be drinking about half your body weight in ounces of water per day. So for example, if you weigh 200 pounds, you want to drink about 100 ounces of water a day. And that's pretty easy to do. That's about 3/4 of a gallon, so it'd be like 3 of those 32-ounce cups of water morning, noon, and night. And so that's pretty easy to do. Now you can use a food diary. You want to keep a mental note of foods that you've eaten, and if you get a headache within 1 to 2 hours of eating something, look back and see what you ate and see if there might be some of those things that I listed in those foods that may have triggered your headache. And just keep a note on that, either mental notes or on paper, keep a food diary so that you can determine what is triggering your headaches. I hope you found some value in this video. If you have any questions, reach out to us. If you know somebody that needs this information, please share it with them. You can head over to our Facebook page, find other helpful tips and tricks there, like our page, turn on notifications so you never miss a post. I'm Dr. Bill Lewis with Tulsa Integrated Health, and as always, be well, my friends.